So my name is Dr. Saleh Idris, Tudun Wada. Tudun Wada is Saleh, not Saleh. Sorry for the correction.
Thank you for the correction, sir. I apologize for not calling it properly. Saleh, thank you so much, sir.
Okay, so my presentation is going to be on medical investigation of suspected homicide. Now, forensic science was born out of the prefix that says there is no crime committed without the suspect leaving or taking away with him an evidence. That is the basis of forensic science. Whenever a crime is committed, the suspect must have taken away or left an evidence. And it is this evidence that we have and use to apprehend the suspect. Now, this evidence we are talking of may come from the body fluids, it may be the hair, it may be the adhesives, it may be the fence from the car, document, or tool marks. If we are talking of poisoning, it may be involving taking samples of the body fluids from the lungs, the blood, the urine, and other fluids for the investigation of traces of poison or medication. Now, the post-mortem process involves three major steps. First step is examination of the dead body at the scene where it is found. That is the most important aspect. Complete and careful autopsy on the body to determine what causes the death. After this, the final step is using the use of both routine and special examination, which may not necessarily be connected with the cause of death, but which may subsequently prove important in the development of the case. Now, note that the scene where the death occurred or where the violence was inflicted may not necessarily be the actual place. The victim might have been stabbed and he was able to run away from the scene. He might have been killed at the spot, but he moved in order to receive that the murder or camouflage murder. Now, the body, sometimes simple superficial examination of the body may reveal the possible cause of the death, but sometimes its evidences are lacking. It is only the careful study of the undisturbed body at the scene and the circumstances surrounding the case that will arouse suspicion that this death may be homicidal. Therefore, it is important that all scenes are visited by the forensic pathologist in order to minimize the possibility of unsuspected homicide passing away unnoticed. In some cases, a complete autopsy may indicate that this might have resulted from violence, but may not necessarily prove that the death was necessarily committed by homicide means. And in some cases, the autopsy findings may be consistent with homicidal, suicidal, or accidental deaths. This is especially in cases of carbon dioxide poisoning, cases of drowning, and other types of poisoning and blunt force injuries. Moreover, the original appearance of fatal wound can be hidden by the operation that was performed at the spot in order to save the patient's life. If this patient died at this later, the forensic pathologist may not necessarily be aware of this treatment unless if the surgeon who treated him at the spot informed him that. So it is important that whatever treatment is given at the spot to be relayed to the forensic scientist, pathologist. Therefore, the emphasis is the forensic pathologist should make it a point to visit all scenes in order to classify the case correctly. Now, what are the protocols at the scene of the investigation? The first thing is the pathologist should record the time he arrived at the scene and the time he commenced the examination, the circumstance under which the body was found, when and by whom the body was first discovered, who, with whom and when the disease was last seen alive, the person who notified the forensic pathologist of the death at the time the first person saw the body. Was it in its original position or was it moved? Whether or not the body had been moved from its original position, and any other attempt that was made at resuscitation, which necessitated the movement of the body. The important thing after this is documenting the scene. This documentation can be done by what? Photographing. Photographing the scene and the prior to the handling of the body and before disturbing the surrounding is important, because this can be used as a record in future. Now, the forensic pathologist should make sure that he takes the diagrammatic scale of the scene. If it is in the room, the arrangement of the room, the furniture, the windows, the doors, and any other materials that may help him in arriving at a conclusion to the case. Also, the weapons, any discharged bullets, cartridges, shells, and any other noteworthy findings should also be noted. Now, how do we even establish that this person has passed away, has died? There are criteria. The first criteria is the extent of what we call the rigor mortis. Rigor mortis is the coagulation of what? The muscle cells. It has variable onset and variable distance, duration, depending on what? The muscle mass and the degree of activity antemortem. Number two, the degree of the cooling of the body, which also depends on the amount of the clothing on the body and also the temperature of the room. Again, the color, location, and amount of the postmortem circulation or lividity. Normally, when a person died, because of gravitational effect, the red cells moves to the vessels and decolorize the skin. Bluish gray, dark bluish gray. Now, presence of any other postmortem changes, such as putrefaction, mummification, that is the mummy, Egyptian style, and the adipocene formation. Adipocene is nothing but what? Waxy materials that is deposited on the body with dead body, especially those in most areas. It consists mainly of unsaturated fatty acid. You also look for what? The destructive marks on the body, possibly caused by what? Insects, ants, and other rodents. Probably the body was discarded elsewhere, away from where life is thriving. So this insect will what? Will thrive on it. Now, this looking for these marks is important, especially toward the entomologist, who may use it as an information to what? Give probable postmortem interval. Now, note that this body, the position of the body with reference to the location and color of the circulation is important, because it determines what? Whether the body has been moved before or after death. Now, going to the preliminary examination of the wounds, sometimes the nature of many wounds will be self-evident, especially in shooting cases. Why? Because cases of shooting have two important aspects: the entry point of the bullet and the exit point. So, because in addition to the entrance wound, obvious exit wounds will be found with corresponding holes of the exit bullets in the clothing. Three things: the entry point, the exit, and probably the exit through the clothes. A search of the premises may then reveal a bullet, and in some instances, a bullet in passing through the body may also carry what? This is the important aspect. The bullet in passing may carry what? A strand of the hair or a fragment of the bone or tissue or soft tissue of the what? The disease. And this can be what? Used as to detect with the forensic fingerprinting. The character and caliber of such a bullet may also show the type of weapon used, whether it was fired from a revolver or an automatic rifle. Why? If I wish you can see my slides. I will show you an entry. So if fired, for instance, if the bullet was fired from an automatic pistol, the ejected cartridge shall be searched for, and if found, will indicate that the disease had probably been shot at the place where the body was found. In addition, you also search the hands of the disease. Why? Because there may be struggle between him and the suspect. You search for the hands for presence of defense wound, one, or the further bones or residues and blood stains. Also objects such as strands of hair and fragments under the fingernails. These are important for later forensic analysis. Now, all these materials and evidences collected should be kept, or maybe all these objects found on or in the body which have anything to do with cause of death or may furnish clues useful for the apprehension of the convict and asylum should be preserved and kept, including what we say, the clothing, the strands of hair, the bullet, the slugs, and all other items collected. Now the external examination of the dead body. The body should be carefully undressed. Why? Because we don't want a situation where it will be soiled or contaminated with blood of or other discharges from the victim. The next thing is to take the weight and the height of the body, and also examine very carefully and describe in considerable details the physical characteristics of the person, his muscular development, the sex, the color, the approximate age, his nutritional status, and muscular development. Also, you look at the color, the length, the amount and distribution of the hair. You look at the eye characteristics, the appearance of the cornea and the conjunctiva, and the color of the iris. Also, the appearance of the nose, ear, and the throat, and also the gums. And also the appearance of the teeth will all be recorded. You also look again at the extent of the rigor mortis. The distribution and color of the postmortem lividity in order to assess whether the body has been moved or not after death, and any communication and adipocyte formation. In addition, you also, because sometimes postmortem mutilation and dismemberment by human agencies may occur in order to hide or to deceive, or to hide the crime committed by the suspect. Postmortem injuries by insects, crustacea, and larger animals, and by mechanical, physical, or chemical agents should also be noted. This is important, especially to the entomologist, because based on the life cycle of the insect present at the distance, it can determine the time of the death, probable time of the death. Also, you look for tattoo marks, the scars of all wounds, needle puncture in case of addiction, scars of drug addiction, amputation, and surgical scars, and the condition of the genitalia. Also, evidence of any bleeding from the mouth, nose, ear, and the genitals should also be noted. Now, the next thing is, after this external examination, you will now go deeply and assess the wounds, the exact location, the size, character, and probable age of all wounds, and the presence of any vital reaction in and around any of the wounds should be recorded. This is important because any changes or faded color of the blues or evidence of infection, inflammation in lacerated or incised stab or bullet wound will indicate to you that it was inflicted sometimes before the death, because we won't have inflammation when we don't have circulation. If all of the recent wounds are found on the body, this must be carefully differentiated and recorded. Sometimes microscopic examination of the tissue from a recent wound will show you a restorative inflammatory reaction, which will not be seen in a wound inflicted just before the death or just before or after the time of the death. You also go forward and take the measurements. Now you take the location of the wounds should be indicated by accurate and easily interpreted measurements of the distance from common fixed landmarks on the surface of the body, normally from the heel. You take the measurement from the heel. The direction and length of any track of every penetrating lacration should be noted, either stab or bullet wounds, and the structures and organs through which this stab passes through, which track the sword has, and the track of such wounds. We also record that. Now, if it's a case of suspected poisoning, if there is a definite indication of suspicion of poisoning, organs such as the liver, the brain, the kidneys, stomach and its contents, lungs and bones, and the blood and urine should be saved for chemical examination. You also weight and measure these in clean containers and promptly deliver them to the toxicologist. The organs should be examined for evidences of disease and traumatic injury, because it may be trauma that inflicted it. And pieces of tissue should be saved for microscopic examination also, because many poisons produce characteristic histological alterations. And certain diseases process that are not visible when you grossly examine the body, and which clinically stimulates or simulates the action of the poison may now become apparent. Grossly, when you do the examination, these diseases were not apparent. But when you do the microscopic assessment, you see them coming out clearly. Where the autopsy findings definitely point to certain poison or group of poison, you should psychologists to go straight for that suspected of detection. In shooting cases, the description of the bullet wounds should include these details, which help to indicate distance from the body of the weapon used in the firing shot. For example, a contact bullet wound produced when the gun is fired with its muzzle attached, held against the skin, will have the appearance which is fairly characteristic. What is this appearance? The skin surrounding this perforation will not contain any embedded powder, grains. As the full blast of the discharge goes, is blown into the track of the wound, which may be blackened and burned. Everything goes down with the bullet inside. So the perforation in the skin will vary in size and is often large and irregular, but sometimes it is small and regular. In a close-up wound, bullet wound, the weapon is fired at close range and characteristically reveals the effect on the skin of three things: the powder, the flame, and the discharge. So you have the three. The distribution and appearance of the embedded powder grains, the extent of the burn and smoke deposit, and their relation to the bullets should be noted. In a close-up shot, the powder, grains, flame, and smoke of the discharge are deposited on the closest, and only the bullet may reach the skin as in the distance shot. In sexual assault, you look for, take fresh and stained smears of secretion taken from the vagina, anal region, and seminal deposits, stains on the pubic hairs and shrouding vulva, or suspicious stains on the undergarment. You examine them for spermatozoa. The organs of the disease should also be examined, especially the brain, chemically for the presence of poison. Possibly before the sexual assault was inflicted, the victim must have been induced with what? A chemical, which might have possibly caused the death. You may also examine the body content for what? Pieces of recognizable particles of food and the degree of digestion. That will change you probably based on what the food is, whether the person died recently or just before. The breast will also be examined for presence of ethyl and methyl alcohol. If the disease, only if the disease died less than 24 hours. After 24 hours, methyl alcohol disappears. You will see it. The presence of alcohol in the brain also indicates that the disease that has consumed the alcohol during the 24-hour period prior to death, if you detect it. However, the amount of alcohol recovered from the brain does not necessarily mean that the amount is consumed, because we have oxidizers. We have people that have, because of the addiction, they have developed the ability to oxidize it. And when you search for the alcohol in the brain, you won't see anything. You also look for the depressant poison, such as chloral barbiturate compounds, morphine, and hyoscine. And this is especially true in cases where you have robbery, because the victim might have been induced before. You also examine the finger scrapings, and here also you do routine blood proofing, and you also examine your clothes. Now, what determines what must reveal to indicate homicide has happened? Now, whatever, also we must establish death by homicide must reveal a cause of death that is consistent with what? The interpretation. For example, a wound or combination of wounds of sufficient severity to produce an immediate or delayed pattern effect on the body must be demonstrated together with what? The effect they cause. If the pathological effect or complication resulting from the wound or wounds may be shock, and if the pathological complication also is directly linked to the cause of the primary wound or injury, which must be demonstrated. And the pathological complication or effect is defined as the immediate cause of death, and the wound or injury causing the complication is the primary cause of death. And the relationship of these two should be what? Definite, not equivocal. And in the case of poisoning, the presence of the poison, this is important. When you are suspecting case of poisoning, the presence of poison in the body and its deleterious effect on the organs must be demonstrated, not only at the autopsy. However, certain poison may be eliminated from the body, only the effect you see after. At autopsy, only the effect and not the poison will be found. And if it was not detected in the patient during life, you cannot use that as a proof. If the poison was not detected in the patient, the findings at autopsy will be difficult to use as proof of poisoning in the absence of poison in the tissues. Also, the natural diseases process revealed by autopsy must be evaluated as to whether it has contributed to cause or death or has been entirely related to it. Now, how do you record this? A record of all these injuries, recording the findings of the postmortem, a record of all injuries and their significance will be made by the forensic pathologist, normally by a trained photographer. She record all visual images, including the video, especially of a specific process, which can be useful in facilitating the review of the postmortem examination. In particular, these images can create as near a record of the processes as possible, may also facilitate further examination of the body in its original state, which is called the virtual exhumation. Assist the investigating officer and the investigating team in understanding crucial elements of the postmortem examination in specific cases, and record the removal of ligatures and other devices from the body where possible. And such a visual recording might also assist in virtual reconstruction where deemed appropriate. And the body should be photographed while it is fully closed and with particular attention paid to the injuries and damage to the clothing. Thank you for your attention.